Good afternoon and welcome to the Healthy Indoors Live Show. I'm your host, Bob Krell. I'm the founder and publisher of Healthy Indoors Magazine, and thank you for joining us this fine Thursday. We have a great show today. We'll be getting into the discussions on asthma and allergies, and from two prominent gentlemen who represent factors of the industry we'll get into briefly. First, we'd like to take a quick pause to acknowledge one of our sponsors for this broadcast, Erlab.
Indoor air quality is now on the minds of everybody. How can we improve the air quality in general? So Erlab is a company that provides protection through filtration for your breathing zone, in the laboratory and outside the laboratory. And why we're here in the commercial space today is to provide protection for the air that we breathe. It's very important in commercial spaces, obviously, because there's a lot of people that come in and out of restaurants, schools, long-term care facilities, whatever it may be, offices. So we want to provide the healthiest air possible so we can get back to some sort of normalcy.
And we're also brought to you by Healthy Buildings America 2021. It's the ISIAC event taking place this November 9th through 11th in Honolulu, Hawaii. Also being hosted by the host organization, CIRI, the Cleaning Industry Research Institute. And the topic for this one is bridging the gap between research and practice. So this will be a really great event. Learn more at hb2021-america.org. So, without further ado, I'd like to bring in our guests. We're really happy to have two very influential people in this industry. Kenneth Mendes became the president and CEO of the Asthma and Allergy Foundation of America, AFA, in early 2018. He came to AFA from AdvaMed, which is the world's largest medical technology association, where he served as executive vice president and chief revenue officer for 12 years. And also Dr. John McEwen, coming to us from Ireland. He is a medical entrepreneur and currently the CEO of Allergy Standards Limited, ASL. That's an international standards and certification body, a company he founded while working as an emergency room doctor. Welcome, gentlemen.
Thank you.
It's great
Good to be
here.
Thanks for having us, Bob.
So I guess, before we get into our prescribed questions, this pandemic has affected people in a lot of ways. I mean, we've been spending more time perhaps in our homes. There's been obviously different social measures, and have those has there been an impact on what you would normally be dealing with from the asthma and allergy issues in the world as the pandemic? Has this, I guess the question is, has the pandemic exacerbated this, or is things still status quo?
No, for us, it's definitely been drinking from a fire hose. We're the oldest and largest nonprofit patient group that represents the 65 million people with asthma and allergies. But the key thing that's happened during COVID-19 has been just trusted information from us as an organization, because that's what we do. Anywhere from symptom charts to figure out, what's the difference between allergies, the flu, COVID-19, where we were one of the first organizations to be out there talking about that, to medication shortages, because we heard about a lot of that, rescue medication for those with asthma and allergies, COVID-19 vaccines, allergic reactions to that, trying to set the record straight there, mask wearing, and now it's back to school. What do you do with the back to school season? So we have been incredibly busy doing what we do. As our mission is trying to get the information out there and educate our community.
Are you seeing, from the standard setting question, John, are you seeing any interest in new products or different products that that may have arose since the advent of this pandemic? Is that changing anything as far as what inquiries you're getting at your organization?
Yeah, absolutely. I think to answer your initial question, has the pandemic impact on the way people see the world? And I think absolutely. Our message, science and the evidence base has always been around improving indoor air quality and optimizing indoor air to have healthier living. And that in the past was a message that people didn't quite connect with. What we often said is, how do you make the invisible, like air, how do you actually make that concept visible? And I think COVID-19 and the pandemic have accelerated people understanding that indoor air is actually really important. And I think people aren't going to go back. We've now joined the dots on this issue. And I think there's going to be a lot of shifts that will persist for a long time. I often quote the point that when people sneeze, you say, God bless you. That's from the bubonic plague back in Europe and London nearly 300 years ago. And that has persisted now throughout society. We still say bless you when people sneeze. So I think people being switched on to air being important and air actually impacting on my health has been accelerated, and I think it will persist for a long time after this pandemic, because it makes sense that your air is the largest thing you actually consume on a daily basis. When you look at the amount of food you eat and the amount of liquid you consume, you actually inhale by volume. Air is the largest thing you consume, and it's the thing, if you take away, you can't live without it the quickest. So we've seen really people getting switched on to the issue that the air is important to my general health and wellness.
What gets interesting with that point you just made there, John, is that people don't see air, though. Right? If you saw what was in the air, you were able to visualize it like you would with let's say, a glass of cloudy water. I think people would be a lot more concerned about what they're ingesting. So to jump into our questions that we talked about earlier on in pre-show, I'd like you both to tell us a little bit, respectively, of how Kenny, how you arrived at AFA, and John, how you arrived at creating ASL, and tell us what you think have been your most significant contributions so far. And I'll let Kenny go first with this.
Yeah, sure. Thanks. Well, as you mentioned in the intro, I've spent a lot of my career in the nonprofit world, recently in healthcare, but I feel important to work for mission-based organizations, and 2 of my 3 kids have had asthma and allergies, and I do as well. So that's how I ended up at AFA. And I'd say probably the thing that I'm most proud of in the short time that I've been at AFA was kind of the work that we do that just improves and maintains the trust that people have in us as an organization. And then we actually were able to pass a couple of pieces of legislation under 2 different administrations. And I'd say one is particularly relevant to this conversation. The School-Based Asthma and Allergy Management Program Act, which we got passed under the last administration, that really looks at indoor air and tries to create incentives for states to create better indoor air in their schools. Excellent.
So, John?
Sure. Well, my kind of founder's story, as they put it, was when I was working I'm a trained emergency room doctor by my profession. When I was working in pediatrics, in emergency rooms and asthma and allergy clinics, generally the parents, the mums of kids with asthma and allergies would be seeing the healthcare professionals, the doctors and nurses and other allied healthcare professionals. And the concept of avoiding your triggers, the things that actually set off your asthma and allergy symptoms, comes up again and again. And we've seen medicine has kind of shifted. Rather than just command and control by doctors, people are much more engaged in maintaining their wellness. And the definitions of wellness isn't the absence of disease. And we've seen that with wearables, the rise of meditation, mindfulness. People really want to do as much as they can to maintain their wellness. And the issue of trigger factors, it was almost like information overload. People would write down what the doctors and nurses were saying, but then what we describe as actionable insights. Now I get the concept that there are these triggers in my environment, and they may show up in the textiles I buy, the materials I bring into my home, how I ventilate my home, how I clean my home. But people found it difficult to actually navigate their way when designing and building houses, when purchasing products. So we designed that certification based on science and based on evidence to cut through the noise in the marketplace and give people actionable insights. And we're really proud of that. We're really proud that we've handed a lot of power back to patients. We've given them informations, and working with Kenny's group, who, as you mentioned, they're a trusted advisor, the patient advocacy. We're very proud of the fact that I may not be an ER doc on the floor seeing one patient in and out in emergency, but our organization is impacting thousands and hundreds of thousands of people by being a lighthouse in that fog around this issue of avoiding trigger factors.
Which that seems extremely important. So the asthma and allergy friendly certification. Let's talk to that just a little bit. Those standards. It looks it's a massive science and marketing undertaking, right? I mean, what does it mean for a product to be certified asthma and allergy friendly, and how does that program reach consumers?
Sure. Well, first of all, it has to be scientifically credible. The reason why we exist, the founding story is cutting through bad science, poor science, things that may resonate with people, like the word hypoallergenic. But if you actually look at the Federal Trade Commission and the other National Institute of Health, there's other organizations in America, there's very little science associated with that word. And you'll see the word HEPA used quite a lot. Just because something may have a HEPA filter, because the way the machine, the vacuum cleaner, the air cleaner is configured, doesn't mean you're actually getting HEPA grade air. The outcome of the benefit may not be associated with the labeling. So first and foremost, we had to have good science. We had to make sure credibly you could demonstrate the product attributes, its performance characteristics, its suitability criteria, and could be clearly demonstrated by scientific protocols in laboratories, in chamber studies, etc. So we had to start with the science and get meaningful thresholds based on position papers from the medical community, the National Heart, Lung and Blood Institute, and then what the various trade organizations were saying, and boil that all down to a meaningful, credible standard. And that was the science part of it. And then really the key to the success of the program is partnering with Kenny's organization and having that credible science peer-reviewed by Kenny's organization and embraced in an educational content platform.
Yeah, we have a medical, just to build on what John's saying, we have an AFA board of directors, but we also have a medical scientific council who are prominent doctors in the allergy and asthma space. Also, there are some general practitioners as well. But once John's organization develops the scientific standard, then they run it by our Medical Scientific Council, our MSC, and there's a back and forth. And once we look at that standard and get it approved, then we send it back to John, and John's organization does all the heavy lifting that you mentioned in terms of the testing and the marketing and kind of working with some of the companies who are out there doing this.
So, I mean, my question would be, the follow-up to both of you on this is, as far as consumers, how do you get a lot of consumer feedback on these products that have been certified?
Yeah, I mean, I would say a couple of things on the consumer side, since we appeal directly to the patient community. I think this spring, for example, and with COVID-19, there has been such focus on indoor air and clean air and COVID and the allergy season. So we've gotten so many inquiries about, how do I keep my air clean indoors? What's the right kind of vacuum cleaner to use, HEPA filter to use? And then now with back to school and all the money that the Biden administration has poured in to investing into clean schools, that's a real issue too, that we want to try and make sure that we clarify what's a good standard to have out there, because there are a lot of organizations who are commercially trying to market into schools, given this additional money being sent in by the government. And we want to make sure that, there's clear guidance on what really is good for kids in schools.
Yeah, I mean, that's a big thing. We've featured that on the show several times over the past few months. Just some of the questions. I mean, we did a show talking about snake oil, and there does seem to be at least a portion of that being marketed to unknowing or just lesser educated, right? Facilities managers at schools. I mean, there's technologies that are pretty much unproven that people are just trying to push out into the marketplace. So that's a little bit scary. Um, and to both of your points on HEPAs, yeah, that's a significant issue. It's not just the filter; it's the efficiency of the device, right?
I
Total
mean,
device efficiency.
John can elaborate on this, but for example, with air cleaners, the one thing you want to be careful of, especially if you have asthma, is you don't want the thing to be throwing off ozone, which is a real trigger for asthma. And you know, the ones that go through our program, John could talk about the standards. We make sure that that doesn't happen. But John, you should really talk about. I mean, you could go on for hours, I'm sure, about this.
I don't want to bore Bob's listeners, but yeah, I mean, I think just to go to your earlier point, Bob, the concept that it's a little bit like the Wild West out there, that the people realize there's opportunity in here, and it is the role of trusted people like the Asthma and Allergy Foundation of America and independent certification bodies like ourselves to play a role in that conversation. Because it's been shown, certainly in the sustainability movement, the green movement, the energy efficiency movement, the more voluntary codes and directives join that conversation, it actually impacts on statutory regulations, on industry codes and various society codes and voluntary codes of practice. And there's actually a virtuous circle, the more people join that conversation. And we're very pleased to be part of that. Kenny, particularly in the school area, how do we clean our schools? What's trustworthy and what's somebody just kind of speculating on an opportunity. So there's a growing evidence to show that voluntary labeling, patient advocacy, patient organizations have a big influence on setting standards and actually making the whole industry raise their game.
I guess the follow-up to that too is, with the pandemic, has there been an increase in consumers reaching out to AFA looking for information and to, I guess, to companies looking to get their products certified through ASL?
Yes, absolutely. The outreach has been there, and I would say when we started the pandemic, if you Googled asthma and COVID-19, we were one of the top 5 organic hits that came up when you would do a Google search. So people are looking for this. They want information. They're asking us all the time about this. So it's a constant thing that we have to be doing and communicating to the public.
John, are you seeing, again, more of a uptick on firms looking to gain your certification?
Yeah, again, absolutely. The lens has been put on indoor air quality. People are telling stories about it and engaging. That's how people engage. It's through empathic listening, and it really now resonates with people, and they get it. And a lot of the measures for COVID-19, some of them actually, although obviously asthma and allergies, it's not an infectious agent, but the same concepts of maintaining good air are related. So source control, so in COVID, that's obviously washing hands, etc. And if you can't control at source, and in allergens, you put barriers, so you limit exposure, same as a face covering or putting an allergy barrier on your bedding. And then obviously cleaning, so removing allergens. You mentioned there about HEPA filters. You really have to capture and remove trigger factors from the indoor environment, not just redistribute them by blowing air, etc. And then ventilation is part of all those. It's part of source control, it's part of cleaning, and actually just removing through good ventilation. So people have switched on to that, and what's something that's actually very good at controlling allergens, it's much obviously larger particle size to a virus, but those concepts and mindsets apply across the board. And another big thing you mentioned about retailers and consumers, there's a real role for retailers to play in this conversation, and really good brands, because they realize that if they've got technically superior products, they need to tell that story in a meaningful, engaging way. And the concept of improving your indoor environment and moving conversations away from air quality or filtration, which are quite technical specifications, to move it, the classic moving the conversation to benefits and outcomes. And what more important benefit and outcome statement is there about healthy home for you and your family and healthy indoor air? So that whole conversation is really going on now, and it needs to be around good science. It needs to be with credible people, and the conscientious retailers know that they need to be seen. Well, what are we doing to give back to our community? How can we be involved in this conversation if we're going to stay relevant, engage with our communities, which is very, very important for the ESG, the environmental, social governance ratings. So there's lots of reasons why the conversation is coalescing around this issue at the moment.
It totally makes sense. And I think what's really important, and you alluded to that, is the high technical aspect of any of the parameters of these devices or technologies or whatever you're dealing with. The general consumer, that kind of maybe falls on deaf ears or is confusing. So it's really important to speak benefit, right? That's
yeah.
We definitely, so one of the things that we do as a nonprofit is we have an online support community. So when you are diagnosed with asthma or allergies or food allergy, you leave the doctor's office with, you need to figure out what to do next. So we've got a free online support community. You could log on to AFA.org. And within that, we disseminated information on, and you could get support from other community members. So we started this long before Facebook, and this is password protected and moderated by staff. And there's an Ask the Allergist piece. But also on our website at AFA.org, we've got a interactive healthy home checklist. So you could mouse over each of the areas of the home. We've got little graphics there and talk about and give suggestions on areas that you can make improvements related to asthma and allergies inside your home.
And how long have you had that availability on your site? That's something that's
we put it up there this year. I mean, we've always had a link to the certification program. This graphic is relatively new in the last year, the mouse over features, but it's quite well used by our community, and you could click on the links there, and then it sends you to what you should be doing, and then also to the certified asthma and allergy friendly website that has a listing of products.
So I mean, obviously, a lot of your outreach is educational based. Has to be, right? You're trying to inform people and give them credible information, and it's tough probably to rise above the din of all the commercial product literature that's not necessary, certainly not peer reviewed, and certainly more marketing in nature than maybe factual at times. And it just seems like during this pandemic, we've seen just a lot of claims by a variety of manufacturers and providers. Air cleaners especially. I mean, the air cleaning thing is just, to me, has been very alarming in the industry. And do you believe consumers are trying to become educated and informed purchasers, or are they just willing to accept what they're told from these companies that sell this stuff?
They're trying, our community, the ones who are involved in AFA are educated, and they're trying to get better information. So we survey our membership on a regular basis, and 74% of the people that we surveyed who are in our community say they get information about COVID-19, the flu, and other things from us. That's just behind the news, their doctors, the government like CDC and other things. So we definitely have a high number of people who come to us because of the information that we give out there, and they use that information.
As far as your certification goes, John, with the ASL certifications, obviously there's, you have an association, or I should say, let me use the term, ask you what the proper term is. Your two organizations work together for certification. Do you also work with other entities? Obviously, there's not an entity just like AFA, but I mean, are there other places where you actually align and affiliate with your certifications?
Sure. I mean, if you want to think about it, that the AFA relationship is very much focused on B2C, consumers, patients, the mums, that type of people, the busy mum who's trying to, as Kenny was saying, they have a diagnosis, they then need to problem solve, and they get this great allergy action plan from Kenny's organization. It's very much patient focused. We're probably more on the B2B side of the house. So we also have an educational program. If you go to allergystandards.academy, we have some training programs there for building related professionals, for architects, and other people associated with facilities management and so forth. And it's very much training business professionals. We work with EBA, the Energy Efficiency Building Alliance. We have a program with them. We're developing a program with the International Supplies and Sanitary Association, the International Cleaning Association, and we've worked with the American Cleaning Association as well. So we will work with a lot of B2B organizations on the trade side, trying to empower retailers. We do retailer training. We may work with the marketing people of R&D companies. Obviously, we work with our clients within the program, like 3M Filtrete, with Dyson, with LG, trying to, again, as you said earlier, bridging that gap between superior science and then really what is the meaningful benefit for a customer to invest in these products that have got proven superior technical advantages. And how do you have empathic conversations with people to really meet them where they are? How do we kind of move that debate about being planet friendly and sustainable to now buildings being people friendly and products and building materials and what we bring into a home being people friendly, not just planet friendly? And how does that Venn diagram intersect? So in our academy, in our institute, we do a lot of teaching around that, but probably more on the B2B side of the house and trade organizations, like, as I said, like EBA. I'll be giving a keynote in San Diego at the US Green Building Council, for example. So those type of organizations is who Allergy Standards works with.
I mean, you mentioned bridging the gap, and that's challenging probably both for the B2B and the B2C. Is it not? I mean, there's gaps. There are different gaps, but there's still that chasm there, is there not?
Absolutely, and it actually even goes up and down the value chain, because if you look at, say, a pillow, a textile product. Now we look at pillows in our standard with regards to the fabric in the pillow, that sometimes they can include within textile spinning and finishing. You can get chemicals like azo dyes. You can have residual VOCs in it. You can have allergenic dyestuffs, residual pesticides. So when we certify a pillow, we're actually working throughout the supply chain to the fabric suppliers and even the people who supply the chemicals that go into the fabric that ultimately gets cut and sewed and fabricated and fills blown in, and it may be in one of the distribution centers, and then it gets shipped to retailers, and then it's stored, and then it's actually put on the shelf. So and then ultimately the consumer buys the product. So it is, without a doubt, our science needs to work throughout the value chain of those products, as well as then trying with Kenny and his team to make sure we've got a meaningful message to the consumer that relates to them as regards to their interests.
So you mentioned presenting at the USGBC show, the upcoming show. So do your organizations have relationships with organizations like the USGBC or the National Association of Home Builders? And there's US centric, obviously, with the home builders, but is that something? Is there an outreach actively with both your certifying body and Kenny with your foundation?
Well, we do a little bit, yes. I mean, and sometimes we call groups, industry groups, when they're not providing the right kind of information out there. So, for example, there was just some new standards that came out from the National Heart, Lung, and Blood Institute on asthma care, and there was one group within the one industry group that didn't quite interpret those the right way. So we kind of reached out to them and we said, that's not what that guidance said, so you got to be careful about that. And they responded back and they said they'd take the information down off of their website. So we kind of are a little bit of watchdogs out there when we see this kind of thing, when it comes over the transom. So we definitely work with a lot of other organizations. We've reached out, for example, our angle on outreach is kind of with the American, the School Superintendents Association, for example, because getting back to indoor air, back to school, indoor air quality, we've reached out to them to make sure that there's masking, that they're focused on indoor air and indoor air in the right way. So trying to get that message and talk to them so they could get out to the various schools and get that information out there.
Now that's got to be challenging right now in the United States, because there seems to be, a pretty big political divide on that topic. And unfortunately, it seems like politics maybe are getting in the way of good science. But obviously, state by state, there's totally different ways that this is being approached. So you, as an organization that in the United States is really talking to people in 50 different states, you have a wide variety of approaches that the state level are taking.
Yeah, no, it's really challenging. That's why I said, for example, when you asked what are we most proud of, or one of the things was the piece of legislation that we got passed in the last administration, signed by that president, who basically tries to improve allergy and asthma care in schools, and that focuses on indoor air. So that's part of it. And then this new administration, there's an influx of funds to help improve school infrastructure. The American Society of Civil Engineers, for example, gave schools, I think, a D plus in terms of the infrastructure.
Wow.
So we really need to make improvements there when 20% of the US population is in school on any given day. And then, people don't realize that, you were talking about nursing homes during the COVID-19 panic, but schools are a lot more dense in terms of occupancy than nursing homes. And now we're on the verge of going back to school. So it's something that we really have to be careful and keep an eye out on.
Yeah, and there's certainly a lot more opportunity for transmission and communication in a school, even than a skilled nursing facility, right? Because a lot of those
Absolutely.
patients are not as ambulatory as students at a school. They're interacting constantly.
Yes.
So that's a challenge. Um, and I already mentioned this, but I guess the question is, has this pandemic, what other ways possibly has it changed the way AFA and ASL does business and provide information? Has that caused, either of your organizations to have to modify as a result of what you're dealing with now in the last 18 months?
John, I'll let you go first.
Yeah, I think to use that cliche, it's accelerated a lot of trends that were there. You raised a little bit earlier just about will people settle for scams and quick fixes and things like that. I think there has been a lot of debate and there's been a lot of divide, a lot of opinions over that. But one of the good things that's come out of it is that people now are engaging and they're researching products. And in the old days, people might it was a kind of a straight kind of a funnel when you bought products. Now, certainly the research from McKinsey is this concept of the loyalty loop, that people will, before they even say choose a professional service, like maybe some of your audience, like architects, etc., they will look at peer groups. We all look at those hotel review sites, etc., restaurant reviews. So people are now doing that for products, and they're doing it for their health, and they're doing their professional service providers, even their doctors. And I think that is a positive, because the more when you know more, you do better. So I think that's something that people research. I think people are on forums and they're discussing. And I think if a product makes a promise and then it doesn't keep that product when you take it home, people will be on review sites and that loyalty loop breaks down. But I think if you actually keep your promise that you make because the product is superior, and again, I mentioned it earlier that the retailers and the better brands, they want to have the conversation taking place around science, because they know they've invested in the products. They know they're making a better product, and they don't want to race to the bottom on commodity and making it cheap. And that won't be the future. I think that's one of the good things that has come out of it, that people are researching products. Products must keep their promises. They must have a benefit to society. They can't pollute the environment when they're made. People are now very conscious of that ESG aspect I spoke earlier. So, and I think they're all very positive. I think even as a doctor, good doctors like to be challenged. They like their patients to be researched. You arrive at better treatment plans when people are researched. We don't want patients that will just take orders and command and control. That's gone out of medicine, and I think it's now gone out of how people manage their purchases. So for me, I think that kind of patient empowerment, the ability to research, the democratization of information are some of the positive things out of the pandemic.
I mean, do you feel that consumers now are more savvy about their indoor environmental needs than previously?
I think so. Absolutely. I mean, if the media is any indication, I've never given more interviews this spring about indoor air allergies and asthma than I have previously. So I think that there's definitely heightened awareness about that, because we've had to spend so much time indoors because of COVID-19. And just to kind of build on what John's saying in answer to your question, I think COVID-19 has done two things for us as an organization. One is we were already communicating information as an online community. That was part of what we were doing. So we were just pumping more of that information out. But because we were remote and because we could do this online and people had to stay home and listen, we were able to bring in the NIH, doctors, and others to give webinars for our community like you're doing here. So that's become a standard of information gathering for our community, as John says, to make them more informed choices. The other thing I think, which has been a strategic emphasis for us, is health equity. And Black Americans are still 3 times more likely to die from asthma, 5 times more likely to be treated in an emergency room, and Black women are still the highest death rates of asthma, and asthma kills 3,000 people a year. So with COVID-19, there's this discussion around health equity. We're already working on that and seeing that through asthma. So that helped bring this top of mind to consumers. And I can tell you, for your audience, and again, when John and I work together, you could do as much medication as possible, but you could, the further upstream you get to maintain your indoor air in your home, there's things that you could do in order to reduce your asthma triggers. That's really important. So to the extent that we could get out there, help those communities, get them more educated about this kind of thing is really important.
Yeah, it seems critically important to try to address some of the causal agents, right?
Yes.
And the environmental ones, things that can be corrected. It seems ludicrous to to not at least attempt to mitigate those as well.
Yeah.
Are you seeing, I guess the same question, do you think in general retailers and manufacturers, are they more savvy to the consumer's indoor environmental needs now? I guess, John.
Yeah, maybe if I take that, can I? Because it's just a really good point. I just would like to reemphasize what Kenny said there about the disparities, but also how some of the early research work we've done with Kenny's organization and other organizations like Breathe DC. We did some work in Philadelphia and Baltimore, where with some of our clients, we went into homes in underserved communities, and we did very, very minor remediation, pest removal. Bob, you were mentioning in the warm-up that mold is an area that you've worked a lot on. Very, very basic mold remediation, and really a coach, like a asthma occupational health nurse, doing a little coaching sheet and a check sheet, doing a walk around of homes, identifying allergen triggers, irritant triggers, sources of VOC, sources of mold, etc. And very, very minor educational interventions. And often in medicine, you see many chronic health conditions like people being overweight, like diabetes, and some episodes of asthma and allergy. They're really educational issues and societal issues of our environment, but they actually get managed in emergency rooms and by expensive medications and expensive interventions. And if we can shift that conversation and empower people really to say, well, look, as you said, look at the sources and educate people. Now, we didn't do large clinical trials and we didn't look at clinical outcomes, but we did anecdotal small studies with the interventional groups. And we had some very, very encouraging results. And Kenny and his team, with some of the associates, potentially with the Johns Hopkins and maybe the American Thoracic Society, were speaking to all these groups about doing something more formal in that area. I know that Patient-Centered Outcome Research Institute, PCORI in Washington, D.C., has identified large funds to look at this issue of allergen avoidance for asthma and allergy management. So that whole environmental area, it watched this space, and a lot of it's had to pause because COVID has become the priority. But that will all come back, and I think it's a really interesting space for your audience.
We had a question from the audience that I'm actually going to pose up here. Are you, and I guess in general, both of you gentlemen, are you seeing more flexibility with asthma and allergy doctors to work with the business community to get out good information and products? It's a good question.
Yeah, no, I think that this new guidance that's come out is really important. So if you're an asthma or allergy doctor and you follow what the NHLBI came out with, you're very much, if you're a good asthma and allergy doctor, you're going to keep up to speed with that. Our challenge is make sure that either the communities can see these specialists who do know what the cutting edge research says about asthma and allergies, or even with general practitioners who aren't necessarily specialists. So in terms of the business aspect of things, I mean, to answer that question specifically, I think the doctors will always go by what the science is. And to the extent that a doctor will say, and it's just given with your asthma action plan, which is something that every specialist or any general practitioner should have. It's all about indoor air and removing the triggers within your home. So that's a really important message. And I think a consumer, an educated consumer equipped with that, going out there can use our website, use John's site, and be better off for it.
Yeah, I think specifically I'll pose this to John. What are some of the triggers of asthma and allergy in the home that people should be aware of?
Sure. I'll just build on Kenny's point there, because it is important that the guidelines speak about no single measure being good enough. It really is a whole of home approach, and a single intervention like bedding sheets or a certified vacuum cleaner or using paints that have low emissions of VOCs. The single interventions on their own don't work. It's really very much a whole of house approach and an additive effect of those, and embracing the concept and becoming educated the whole idea. I think that's the message. We don't recommend products, we don't endorse products, and we don't ask any doctors to do that. What we have made available as resources, as Kenny's mentioned, on the asthmaanallergyfriendly.com website and afa.org, is if you are trying to achieve this goal of optimizing your indoor air, here are some products that have reached certification criteria that can contribute to that. And that's very much how we like to present it. We have a certification criteria, and products that achieve that criteria are awarded the certification. And those products will help as part of a whole of house approach. So it's not an endorsement, they're not recommendations, they're certainly not clinical claims. We stay 100% away from that. What we're saying is this product has been tested under scientific conditions to achieve these outcomes. It will remove allergens. It will capture those allergens and not redistribute them. So I think for the whole doctor conversation, it is very important that it is a medical condition. Your physician must stay at the absolute heart of managing medical conditions, and family doctors must do that, absolutely. And then to go on to your fact, what are the triggers? What can we do things about? Well, the classic one is obviously we spend 90% of our time indoors, unbelievably, and as Kenny mentioned, even more so in the pandemic. But whether we're in schools or in transport to our places of work or in the places where we live, we're generally indoors. And of that time indoors in homes, it's going to be the bedroom and it's going to be probably the kitchen. So in your bedroom, you're thinking of the classic triggers, the dust mite allergen, etc. In urban areas in the US, often the indoor allergen can be cockroach allergen more so than dust mite allergen, and then potentially pests as well. So they're all your biological triggers. You can kind of break them down into kind of three buckets. One is your particulates, then you have your chemicals, and then you have your biologicals. So in your biological area, dust mites and bed and textiles is an issue. Then if you look at chemicals, you're talking about off-gassing of volatile organic compounds. They're volatile, as I'm sure your audience know, or semi-volatile. So they emit or they outgas. They actually originally would be put into solid products in a solid phase, but they emit over time. And that's classically your building materials. It can be in floor coverings. It can be in paint and actual the building material itself, and things like insulation products as well. So we look at those type of products. And then particulates in the home, I like to describe them as your cozy culprits, the type of things that you'll see. Obviously cooking can be a source of particulates. People may use scented candles. We particularly don't like some scented candles because not only do they have particulates and potentially VOCs, often they're put in to mask odors of a real issue like some mold or something else, and we would like people to tackle at source rather than to put in masking odors. It's the same reason why heavily fragrance cleaning products sometimes may not be a good idea, because they can be harsh themselves, but you're really not getting to the issue. So
yeah, the masking, yeah.
home triggers.
What's fascinating too is, at least in the United States, and I can't speak to marketing abroad, but in the U.S. to general consumers, this concept of these fresh odors, these esters that are added to the various products and stuff to give that clean citrus scent or whatever. And really, I would say, and you probably agree, right? The actual scent that clean should have is no scent whatsoever, right? It should be the absence.
So that's, it's funny because that's what we struggled with, because John and I have talked about this well before my time, but we struggled with can you create a standard that involves some fragrance in it, and that's really tough.
It
Well, the
is.
problem is consumers want that because it's been driven into our minds for the past 50 to 60 years.
Mhm.
That these all these products and all these fresh scents and
Yeah.
I mean, it's a trigger for me. I go in and I have there's certain cleaning smells that it will just trigger a sneezing episode for me, and that'll be, down the road, lead to an asthma thing. So
Mm.
I've lived it. I get it.
Yeah, it is an issue, because a lot of the empowerment we're trying to do is around adherence to treatment plans, adherence. We used to call it compliance, now it's adherence to the asthma action plan. Fragrance is difficult, as Kenny, it's a debate amongst the committee, and again, we must follow the science on it. It's like some floor covering as well. People like soft floor coverings. So how do we actually serve the community and say, can we give guidance on this area rather than a blanket ban, which may not actually serve people because they want their houses when they're clean to smell of lavender or Irish breeze or whatever it may be. And to think people aren't doing it is probably incorrect. It was a little similar to when the first generation of bedding allergen barrier products were quite sweaty and uncomfortable and weren't good at water vapor transmission or airflow, or they were noisy. So people just didn't use them. And now there's much better products in our certification program that actually pass criteria for comfort and wickability and things like that. Fragrance is another area that there's ongoing research in as of soft floor coverings as well. Clearly, there are ones that we don't want people to use, but also there are adherence issues. We say, well, if you are going to clean and you do want your home, as you said, not smell of nothing, smell of I've done a great day's cleaning. Well, is there a way you can do that? And it's an interesting debate. We don't have the answers, but we're certainly working on it.
As far as again triggers, such as fragrances, or some of the chemical constituents that are potentially triggers for asthma and allergies. Is this something that everybody should be concerned with, or just asthmatics and people with diagnosed or somewhat severe allergies? Is this a problem for all of us?
Well, I'll have a quick go there, Kenny, and then I think without a doubt, people with hypersensitive airways should be more switched on to the issue. It is more relevant, particularly then if it's a known allergen and you're allergic to that allergen and it's a known trigger. You should avoid it. The concept of increasing VOCs, whether it's car fragrances or there's certain ones that you need to plug in, so they they use electricity and they cause fragrance. I think having lots and lots of fragrances, exposures, stacking and stacking on each other is relevant to everybody. If they're in the air and in the detectable, the fragrance, there's actually an additional chemical in the air that may or may not need to be there. So I would say all of us need to be switched on to VOCs and esters and other things, particularly the ones that are known irritants to everybody. Even a non-allergic person is irritated by formaldehyde, acetaldehyde, which we see in MDF furniture, some of the paints, etc. So there's clearly VOCs that are not good for all the population, and then there's a subset of the population that should be interested, and then there's particularly the people that are allergic to it as well. So I would say it's something for all of us to be interested in.
Let me take another angle on that, if I may, on what John was saying, because Bob, you mentioned early on you can't see the air. It's like you can't see cloudy water. Mm-hmm. But our community, we are the canaries in the coal mine. And I have seen it this spring as we've had a more intense allergy season. longer growing seasons, so that increases the allergies that people have. And I've done so many interviews and talked to people who say, I've never had allergies before, and now I'm having them more than ever before. So the outdoor air and climate change and what's going on in our outdoor environment is having an impact on the health of everyone in the country. And that outdoor air also comes in the indoors, but it does have an impact on people. And we are seeing this, and we don't know what the causes are, but certainly the irritants in the air right now coming from wildfires, you've seen it, and the relationship to more severe cases of COVID-19, and longer growing seasons because of climate change and pollen and allergies are all having an impact on our health. So, I mean, that would be my answer to your question, one angle on that. It's something that we really need to keep an eye out for, the climate change piece, because that does have an impact. I mean, these immediate changes for indoor air are important, but the bigger picture of things is what can I do is really kind of clean energy, all the things that contribute to lowering our CO2 in the atmosphere and reducing climate change.
And this is something that's, in all, with all indications is going to continue to ramp up. So this is not like we're at a static point here in time. Seems like there's more of a prevalence of wildfires, more of a prevalence of catastrophic weather events, which, we're experiencing those today. It's just, and all of this, obviously has a direct impact on the indoor environment as well. And again, I'm not so sure that you can always separate. In fact, I don't think it's even wise to mentally separate the indoor and outdoor environments completely anyway, because we live in the overall environment, right? It's our indoor built environments are still part of the outdoor environment. They're sitting there. So
I think that's really important, and it's great that you're sending that message because people need to connect the dots. You can't separate the two.
One thing you both mentioned earlier in the conversation here today is the disparity with how underserved communities, their properties, their living environments, how they, were certainly more acutely affected by the pandemic, but in general, right? That there's a disparity there, and as far as the healthiness of the living spaces, the indoor home environments for everyone, right? Based on demographics and socioethnic groups, right?
No, absolutely. And so, per what John was saying earlier about the local communities, we're in coalitions. We work with folks where there'll be a home visit program where you'll have someone, a social worker or someone else, who will visit a home as part of an asthma-based program to talk to that person and talk to them about what the triggers are in their homes. Now, this program happens to be affiliated with Children's National in DC, the one that we're partnered with. And the demographics, the neighborhoods are Section 8 housing, for example. And so, but Medicaid, for example, will pay for the home visit, knowing that that will save costs and improve outcomes for the occupants down the road. So those are the kinds of things where systemically in your housing, as you mentioned, those are things that we really need to fix. I mean, we could have better treatments, better, better therapies, but unless you improve where people live, both not only their homes, but their access to education and other things, food deserts, grocery stores. I mean, all those things have a major impact on health inequities.
And I got to believe that this is exacerbated by this past 18 months in this pandemic, because there's been more economic disparity probably as a result of, one of the things that I took note of a lot of times on our previous shows throughout these past 18 months on the COVID related topics is that most of the guidance, at least that I see from CDC, US based guidance, all talks about how you can isolate in your home and do all this stuff. And it's all based on the single family house with the white picket fence.
Yeah,
the mindset, it's like if you're living in a crowded multifamily complex, you don't have that opportunity to distance yourself from others.
Exactly.
Necessarily.
And you have to take public transportation.
Yeah.
And no, it's a challenge.
Yeah, and I don't, again, there's a socioeconomic issue here that's much deeper than the health impacts, right? I mean, it's like you have to address that, right? That's
Absolutely.
the cause That's the cause. Yeah.
Yeah,
Wow.
there's also, if I can just maybe throw something a bit more additionally controversial into it, because for your listeners, there's also a medical cultural thing on it that medics. If you think of there's two doctors, and there is a Chinese kind of parable around this about three brothers who are doctors, but it's based on that if there was a doctor who worked in an emergency room and a patient came in, status asthmaticus, very, very severe asthma attack, needed intubation to be treated and gone to ICU, and the patient's life was saved. There's that doctor. But then there's also the other doctor who may not even wear a white coat, who goes to houses and avoids those triggers, or maybe tries to reverse some of that social injustice, and the patient never needs to go to the emergency room ever, and avoids that because it was actually dealt with at source as good medical management, good coaching, good education, and good removal of trigger factors in the environment where possible. Which is the better doctor? Which doctor should be funded more? Where should the resources go into? The acute emergency room with all that kind of the heroics, inverted commas, or quietly going to society and actually just getting on and making sure the patient doesn't arrive in the emergency room? So there is a kind of a cultural aspect about what's the right medicine to do, where should we put the dollars and where should we put the funding? And I think that's something for your listeners just to ponder about where is actually the best money spent in society in intervention.
Well, it seems like being proactive, it should be the best approach. It seems that way. Again, in the United States, we're still a for-profit medical system for the most part. That doesn't necessarily play into the overall narrative here. As if we want to get controversial, we'll take it all the way. But I'm not sure there's an incentive. There hasn't been to date enough incentive for the latter that you described, John.
Sure. I mean, I think that I don't have the exact figures, but there was a recent paper published at the U.S. Green Building last year that about 80% of your health outcomes are related to your environment, and that will talk about your social environment, but also your physical environment. 80% of health outcomes are related to that. What you eat, or whether you smoke or not, etc., is all your environment. But a tiny proportion, maybe about 1 or 2% of the U.S. health budget, actually goes into managing that. It all goes into the interventions as a consequence of not managing that. So there's another controversial one for you. And if we can, through some of our research, show that the numbers stack up by actually doing the interventions about our environment, build better houses. I don't envisage a world where, an architect is wearing a white coat and part of the ER team. But there is a spectrum, and the people who design and build and ventilate our homes are somewhere on that health spectrum. They're not in the emergency room, but I think in the future, they're part of that conversation as we go forward, as we design our communities and our buildings.
Yeah, there clearly needs to be a paradigm shift. What's interesting, and just not to get too deep into the weeds here because we're near the end, we produced another show for ISIAC, the International Society for Indoor Air Quality and Climate, and our debut of that show several months back, we had two Scandinavian researchers who were, and specifically talking about indoor environments in schools, and I was under this false impression as an American here that Scandinavian schools, their public schools, were so much better as far as the indoor environmental quality than ours are here in the United States. And I got a rude awakening there. They have most of the same issues, and I assume that's probably true in the UK and everywhere, right? This is kind of a systemic problem with schools. I mean, and timely because we're now, at least in the United States, launching children back into school. We do need to change some things. I wish we had another hour, to be honest, because this has been a great conversation so far. I'm going to give you each an opportunity for a closing thought. It really just a point maybe that we didn't make, or just some of a summation for you. So I'll let you think for a second. This is. I really applaud the work that both of your organizations are doing. This is really important, and I'm really happy that we've had this opportunity to connect, and looking forward to continue to work with both of your organizations to help disseminate your information, because I think it's super important and valuable. So, closing first, I'm going to let Kenny go first.
Okay. No,
So,
no, thank you for having me. And I think these are, as you're saying, really important issues. I would just say now, visit our website, aafa.org. You'll see the healthier home things there, but all the information that we get out to consumers. And we've got a COVID and asthma toolkit for schools. So it's a back to school toolkit that has lots of information. Now it's directed to parents and the consumers. So it's not B2B, but you could see the kinds of messaging that we're getting out there that's really important as we approach this back to school season, because it's going to be pretty critical, I think, given what I'm seeing right now and what we're hearing policy wise in the United States.
okay. And John.
Well, great. Well, it's a great segue, Kenny. Thank you. And Bobby, I really enjoyed the conversation. I'll take the B2B side of the house. And so as my message will be built on what you said there about a paradigm shift and a cultural shift. And we've developed the Allergy Standards Academy. Again, the website is allergystandards.academy. And what we've tried to do is, because people aren't going to trade shows and they're not putting budgets into booths, etc., we've developed an online educational program to empower building related professionals, architects, facility management, to understand the whole concept of indoor air quality, so they can have better conversations with their clients. If they're speccing a building, the wider architectural team as a building project goes forward. And we have some design thinking programs on there. We have a healthy home awareness program. And really it's about capability for people, building capability to organizations. We're seeing this kind of resignation epidemic, people leaving companies. So we know people want to invest in non-technical capability building, like innovation, like leadership, and we have those programs, but specifically developed for healthy home awareness and building related professionals. So please go to the Academy page, allergystandards.academy. There's some trials there. You can dip in, dip out, let us know what you need. And we're just trying to build that level of education for building related professionals.
Excellent. Excellent. I'd also like to let our viewer audience know, we 2 months ago, Healthy Indoors Media, we launched an online global community, and this is a new platform. It's really nothing like it that we've seen on the planet. It's specifically indoor environmental centric, so it's free. Some of it is just totally public open. A lot of it will require you to register, but still free, and give you access to network with other professionals from various sectors around the globe, as well as share information and even attend events. With the ISIAC Healthy Buildings America event, the online portion of that will be live streamed there. That's a pay-per-view. That one's not free because it's an international conference. But again, this will be I think a great place for those of you out there, if you're looking for more information or looking to commensurate. That's not the right word. Connect with others. I'll leave it at that. So thank you so very much, both of you, for joining us. Kenny Mendes, again, the president and CEO of AFA, and Dr. John McEwen, the ASL founder and CEO. Keep doing the good work that you're doing, and we greatly appreciate having the opportunity to speak with you directly here on the show today. We'll be back again next week, next Thursday. We're here on Thursdays from 1 to 2 p.m. Eastern time in the U.S., and we'd like you to join us as often as possible. But definitely visit global.healthyindoors.com, where you can see the replay of this particular broadcast if you'd like to watch it again, as well as look at all of our past broadcasts and take a look at that information there. So until next time, I'm Bob Krell. Please stay healthy.